We often get clients that have a retiree benefits plan and they don't realize that the retiree plan that they have is actually a Medicare Advantage plan. And it may even be an HMO plan that requires you to stay inside a small network of doctors and hospitals and get referrals to see specialists. Many people are distraught and confused when they find this out. In a lot of cases, they feel like they were misled when choosing the group retiree plan offered by their former company. To help with some of that confusion, we're going to show you exactly what to look for to make sure your retiree plan isn't actually a Medicare Advantage plan. And guess what? If you find out through this video that you're actually on a Medicare Advantage plan and you don't want to be, you can still change your plan, and we're going to tell you exactly when and how. Hi, my name's Hannah Skinner and I'm a licensed insurance agent at the Senior Savings Network. In this video, we're going to compare a retiree benefits plan to a normal Medicare Advantage plan that can be purchased by anyone so that you can see the similarities and the differences. I will also show you some alternatives like a Medicare Supplement plan so that you can compare the cost and coverage. This video is not a direct comparison of your options, as they vary by zip code, age, and the company that offers the coverage. If you would like to compare your exact options, which I encourage you to do because it's completely free, you can call us at the number listed below. The first thing that I want to mention with retiree plans provided by an employer is that these benefits are strictly for people who were employed by a certain company for many years. They're not available on the open market, and once you decide to leave the plan, you might not be able to join again. Many people think that their retiree plan is just an extension of the coverage that they had when they were employed, when actually it transitions into a Medicare Advantage plan. And some of those plans can be worse than what is available for everyone else who enrolls on their own. With either of these options, group or individual, you must enroll in Part B of Medicare and pay that premium. This year, the premium is $202.90. Let's take a look at a retiree benefits plan that is offered in Kentucky. This plan is offered by Humana, and as you can see right here, it is a Medicare Advantage PPO plan. It literally says it in the summary benefits, it's Medicare Advantage. On this plan, you do still have networks. So right here you see an important update, which is that a bunch of hospitals and providers are no longer in network with Humana. So the same things that happen on a normal Medicare Advantage plan can still happen on your group plan because it is a Medicare Advantage plan. You can see in the wording that they use in the plan, in-network maximum out-of-pocket and out-of-network maximum out-of-pocket. So there is a network on this plan, just like with other Medicare Advantage plan. With this plan, you do still have to pay the Part B premium of $202.90, but this plan has an additional premium of $194.23. Depending on how long you've worked for your employer, your premiums could be different than the premiums from someone else at the company. For example, with these plans, someone who's worked 20 plus years with the same company could get 100% of their contributions paid. For someone who's worked less than 4 years at the company, they will have to pay the full amount. So back to the summary of benefits for this employer plan. On this plan, you would have a medical deductible of $500 per year. So that means that you have to pay the first $500 before the plan pays anything. The plan also has a maximum out-of-pocket of $1,200. So that means that you will never have to pay more than $1,200 on any of your medical expenses. That does not include your prescription drug expenses though. Let's go through the summary of benefits of these plans side by side. Starting with inpatient hospital coverage, you'll see that the retiree plan does have a lower hospital copay. It's only $231 per admission. On the regular Humana plan, it's $530 per day for the first 5 days. After day 5, it's a $0 copay. But when you go down to things like the primary care provider or a specialist copay, on the retiree plan, you see that the primary care copay is $15, while on the regular Humana, it's only $0. The specialist on the retiree plan is $25. On the regular Humana plan, it's $40. For emergency care on the retiree plan, it's a $65 copay, while on the normal Humana plan, it's a $130 copay. For MRI, PET scan, CT, on the retiree plan, it's a $15 copay at a primary care provider or a $25 copay at a specialist office or 4% of the cost if you go to a freestanding radiological center or outpatient hospital. On the open market Humana plan, you see that those costs go up to around $200 up to $335. Now, obviously, the copays on this retiree plan are going to be less because your premium is a lot more, but that's why it's important to review it. Different things might be important for different people. If you're very healthy and you don't go to the doctor very often, and you're looking for a plan that has extra benefits and a lower premium, then one plan might be for you. If you're looking for something that's got more catastrophic coverage, or you go to the doctor quite often and you're more willing to pay that higher premium, then the retiree plan might be for you. This plan does have $1,000 towards preventative dental. So that's things like bite wing x-rays, periodic oral exams. It doesn't have any extra vision, and it doesn't have any extra hearing either. It doesn't have prescriptions included, like I said earlier, so you do have to get a separate plan for your prescriptions based off of what type of medications that you take. The lower of the two plans is $55.10 per month, and the premium plan is $199.94 per month. And yes, that is on top of your Part B premium and the medical plan premium. So if you have expensive drugs, you're now up to $600 per month in premiums. Now let's take a look at a normal PPO Medicare Advantage plan that you can get on the open market from the same exact company, Humana. You do still have to pay the Part B premium of $202.90 on this plan, but you have no additional premium like you do on the retiree plan. That's right, the plan is $0 extra premium. There's also no medical deductible on this plan like there is with the retiree plan. So there's a $500 savings potentially when you go with this plan versus the retiree plan. The maximum out-of-pocket on this plan is $6,250 in network and $9,600 out of network. So if you go to all in-network providers, you will never pay more than $6,250, but if you go out of network, that number goes up to $9,600. An important thing to note here is that this plan does have $1,500 towards dental for preventative and comprehensive services. So that means that you can get your cleanings and your bite wing x-rays done, but you can also get things like crowns, fillings, dentures on this plan. You also get hearing coverage, which you don't get on the retiree plan, and you get up to $350 in vision coverage, which again, on the retiree plan, there's no vision coverage. This plan also has drug coverage included. The maximum out-of-pocket for the drug coverage is separate. It's $2,100 this year, so that is added onto your original maximum out-of-pocket of $6,250. So just to give you a clearer picture, yes, the open market PPO plan that everyone can get has some higher copays and a higher maximum out-of-pocket. But the retiree plan is $400 more a month in premium with no vision, no hearing, limited dental, and separate medical and drug coverage. I'm not saying that you should choose the open market plan and pick an individual plan over your retiree plan, but saving $4,800 a year in premiums would definitely make me think twice. Now, we compared those two plans because they have a similar structure, but there's actually a third option in this scenario. You could go the route of original Medicare with a Medicare Supplement plan. Remember, with Medicare Advantage, you're under managed care. You have a network, you have prior authorizations, and your Part A and B are on pause. On the opposite end, you have original Medicare. Part A for hospital, Part B for outpatient medical, and Part D for prescriptions. You don't pay anything for Part A if you've worked at least 10 years into Social Security. You will still have to pay the Part B premium of $202.90 in 2026, and Part D has a premium that is based on what medications you take. It could be anywhere from $0 a month up to $200 a month. And then you could add a Medicare Supplement to fill in the gaps of Parts A and B. We have several videos on our channel about what cost Medigap plans cover. Plan G is the most comprehensive plan you can purchase, so we'll use it for our example just to keep things simple. There are several other Medigap plans available, and we have a video on our page that goes over every single Medigap plan. With a Plan G, your only out-of-pocket cost will be the Part B deductible, which is $283 for the year. So if you have health problems, that could save you literally thousands in medical bills each year. A Medicare Supplement Plan G covers all hospital costs. Once you pay the Part B deductible of $283, the plan pays for all of your doctors and outpatient costs too. So you pay nothing more per year than $283, even if you live in the hospital every day or see 3 doctors a week. With the Medicare Supplement, you enroll privately. You have no networks and no prior authorizations, except for 6 states that are going through a trial program called the Wiser model. An average Plan G in the zip code of the 2 Advantage plans that we looked at earlier is $150 per month. So for $100 to $150 less per month, you could have full medical coverage other than a small deductible, no networks, and no prior authorizations. Now, Original Medicare doesn't include dental, vision, and hearing benefits, but there are plans that you can add on for around $50 per month. So you're still paying about $200 less than your retiree benefits package and getting more coverage. Obviously, everyone's retiree benefits will look different based on who you work for. Your copays, maximum out-of-pocket, deductibles, premiums, all differ. And the plans available to everyone will differ based off of your zip code. But the important thing that we want you to take away is that you have other options. Your HR benefits director might have only introduced 2 plans and told you to pick between the 2. Well, those are the only 2 plans that they are offering. You're still able to get a Medicare Supplement plan or a Medicare Advantage plan that is available in your area if you find that it fits your needs better. If you're already enrolled in your company's retiree plan and you'd like to change it, you still can. The annual election period is right around the corner. This is the period from October 15th through December 7th where you can change from a Medicare Advantage plan to Original Medicare with a supplement, or you can change from one Medicare Advantage plan to another. Please remember that enrolling in a Medicare supplement outside of your initial enrollment period when you first enroll in Part B means that you have to go through underwriting to be approved. Underwriting means that they can ask you health questions and can deny your application for coverage. We work with many companies and are experts in underwriting guidelines, so we can help you navigate which plans and companies that you're eligible for. Deciding what the best decision for you is a hard choice, and it's important to know what to look for when choosing your Medicare plan. That's why we're here to offer guidance. If you liked this video, give it a thumbs up and subscribe to our channel. And comment below if you learned something new today. Thanks for watching, and we'll see you in the next video.